and that's Community Innovation in Action. So our first presenter is Sarah Hansen, and she's from Nine Circles Community Health Center, and her title of her presentation is Meeting the Moment, Integrating Street Health, Addictions Medicine, and Primary Care. So,
okay, everyone can see it?
Yeah, good job.
Yeah, okay,
yeah.
perfect. So once again, my name is Sarah Hansen. My pronouns are she, her. I work at Nine Circles Community Health Center as the project manager for the Meeting the Moment project. Land acknowledgements are an essential part of our identity as Canadians. They remind us that our country is built on cultural genocide that contributes to ongoing systemic oppression and colonization. These land acknowledgements by themselves are not enough. They must be accompanied by action. I am a white settler residing on stolen land. Nine Circles is on an organizational level, and myself on a personal level, commit to recognize the harms of the past and actively work to challenge ongoing racism, stigma, and systems of oppression. Just to introduce Nine Circles Community Health Center, here's some content from their social media page. We are a community clinic with expertise in the care and treatment of HIV, hepatitis C, and sexually transmitted and bloodborne infections, or STBBIs. They provide comprehensive primary care, social support, education, and prevention services. Our core values are to provide care that are not judgmental, prioritizing safety across culture, gender, sexuality, diversity, all from a harm reduction lens. And Nine Circles received a grant from Health Canada's SUOP, or Substance Use and Addictions Programming. Their program funds innovation in substance use prevention, harm reduction, and treatment. So for a bit of background, also I might breeze through these slides just because I could talk about this for literally hours. If anything piques your interest, I would love it if you would reach out to me later. So the background, Winnipeg's downtown and Point Douglas areas. As you can see on the heat map, they struggle with poverty, homelessness, sexually transmitted and bloodborne infections, and injection drug use and racism. They also are facing barriers to accessing care. They may be unable to attend a healthcare setting for appointments because of barriers such as mental health, addiction, or a history of discrimination and trauma. So the priority population of this project are those in Winnipeg's core areas who are using substances, are unstably housed, or experience social exclusion or isolation. And this is on the photo on the left, that's actually one of the encampments. People were camping out in bus shelters in the city. Our project goals, building trust is the first priority, and connecting with our community that we aim to serve. Meeting the Moment combines street outreach, addictions medicine, cultural programming, peer support, social support, and housing referral services. The project partners with community organizations to pilot low threshold services in community settings to reduce barriers to accessing care. And on the top right is Tina's Safe Haven, underneath is Main Street Project. Both are shelters that we have pop-up clinics running out of. Peer engagement is another goal that we have. Who is a peer? It's a person with lived or living experience with the population that you are serving. So we meaningfully engage peers in all levels of our project, including them in design, promotion, implementation, and evaluation of our interventions. So they help guide the project and build trust in our community. We have an advisory committee that meets monthly. We do trainings with them about healthcare and harm reduction. They have first aid certification. They're included in all of the team building activities that we do. We went medicine picking. We're doing a sweat lodge with them next month. And shifts in all of our interventions they're included in as well. All of this is paid. Their experience is valuable. They have a lot of insights to give us that a lot of us in healthcare don't have. This is kind of a summary of the activities that we've done and just some photos. I'll go a little more in detail with our outreach and pop-ups in a second. On the top right, we were doing some panel discussions for safe supply prescribing for prescribers. On the bottom right, we did a study in Winnipeg to see if fentanyl test strips would be used if they were available, and would they be effective. Our pop-up clinics are multidisciplinary. So we have peer support workers, cultural support, social worker, and a nurse practitioner, and a nurse who's myself. Our social work funding was cut, so we no longer have that function, but we are partnering with our organizations to connect with their social work so that clients can still have their needs met. And our cultural support work can actually fill in some of those gaps as well with helping people with housing applications and EIA and things like that. Our nurse practitioner, what we offer is anything that you can go to a walk-in clinic for, so acute episodic care, but longer term or chronic complex care concerns need to be referred out. And we're in community settings. On the top right, we're at a community center. Our clinic room was actually in a broom closet. On the bottom right is us at Main Street Project, and our clinic room is actually in a pop-up tent. Everywhere we go, we bring harm reduction supplies for distribution as well. Results so far, our cultural support worker, this graph shows how important having medicine available for folks is. It's the most used of her services. And for social work, service coordination was really important. The systems in Winnipeg can be really difficult to navigate and complicated. So having someone be able to help advocate and be present with someone while they're figuring that out was really important as well. The average age we are seeing is 33, youngest was 13, oldest was 66. There's slightly more men than women that we've seen. A few we didn't have gender data on, and there was 4 trans folks that we've seen. Notably, half of our clients reported using substances. And the substance type, the majority of substance use reported is methamphetamine. Sorry. Our nurse practitioner, the majority of services has been education and STBBI. Those go hand in hand. When we do testing and treatment, we also provide education. And to correlate with that, the majority of the prescriptions are antibiotics. We bring treatments with us so that if someone comes in with symptoms or we see that they are syphilis positive, we can actually treat them on the spot when they're there. Below, it lists some of the referrals that we're able to do from our nurse practitioner as well. This photo is one of the encampments along the river in Winnipeg. It's just showing this is how people are living in, minus 45 weather at times, and that's us doing outreach. So the pit stop is 9 Circles walk-in access to harm reduction supply distribution. So we decided to bring the pit stop into the community. We're going to the encampments in Winnipeg's core areas. Our nurse practitioner also was doing outreach partnering with the Winnipeg Regional Health Authority to locate folks who have been diagnosed with HIV but have not been able to access care. So in only 4 months, she made 13 connections, and 9 of those are reconnected to care and treatment. 2 of them are still declining care, but we're not giving up on them. And some challenges that we faced, because of the limited funding, we can only offer interventions 2 days a week. We can't be someone's primary care provider. It's basically a walk-in service. And what we were trying to do was make the initial connection with folks and then refer them to a primary care provider. But what we've been finding is that there is just such a lack of capacity for primary care providers locally. So it's really hard to get appointments. And then on the times where we do get appointments for folks, they're still facing all of those barriers that I talked about before to follow up. They're not able to make their appointments even when you are able to get an appointment for them. So they end up coming back to see us week after week. And COVID-19, as we all know, has been a challenge for everybody in adapting how we how we do our services, and we had a bit of a delay when we started our interventions because of it. And so what we've learned, meeting people where they're at is really, really successful in creating connections and providing care for this population who historically have not been able to access traditional models of care. Heather's story. My story is about the Meeting the Moment team from Nine Circles when they were doing outreach at the Merck Center. They taught me that used needles can give you HIV and Hep C and gave me a better understanding of how STIs spread. What I liked most is that they weren't judgmental at me for being an IV user. I felt heard and felt no shame in talking openly about my situation. Other places that I've disclosed to about my disease immediately treated me differently and looked down on. That just kind of illustrates how important the non-judgmental approach is and meeting people where they're at. Having multidisciplinary and holistic care has been great for both service delivery and also development of us in our team, the staff, and the peers. We all learn from each other, clients learn from us, we learn from clients, and the team all gets to learn from each other as well. Learning through trial and error, we're really able to be flexible and responsive to the population base. We can create, test, and revise, and we're always learning and adapting what we're doing so that we can have our
Time is almost up.
Okay, our needs, population needs to be met. Community-based primary care is showing success as a model of healthcare in supporting this population base. How can we be more flexible and change how we offer healthcare to better serve this community? Can we evolve healthcare? Thank you. That's it. Like I said, if anyone wants to connect, contact info is there. And we also have the beginning stages of social media as well that you can follow.
Thank you very much, Sarah. And now on to the second part. And it's talking about Manitoba Satellite Sites. And that is Veda Koncan from Manitoba Harm Reduction Network.
Hi there. So I just get going, Ken?
Yeah, just as soon as you're ready, just start her up.
Okay, great. One sec. There we go. Hi, folks. My name is Veda, and I work at the Manitoba Harm Reduction Network. My pronouns are she and her. Me and some of my colleagues are here today to talk a little bit about one small project at the MHRN, which is our satellite site project that started in March. The rough outline is that the 10-minute outline is that I'll take about 2 minutes to talk about an overview of the project. Then my colleague Heather in Pine Falls is going to talk about the support that the sites are offered through the project. And then we have a few of our satellite site operators here today, Dawn in Winnipeg and Chase in Pine Falls, and maybe a third person too, who will talk about some of the benefits and challenges of operating satellite sites. I'm here today talking to you on Indigenous land, commonly called Winnipeg in Treaty 1, using hydroelectricity from Treaty 5 and water from Shoal Lake in Treaty 3. As a settler doing work here, it's a part of my responsibility to continue to interrogate the systemic violence that continues to target Indigenous folks and other people of color, and also support peer-led and Indigenous-led innovations to dismantle and work around those harmful systems. And I think satellite sites are a good example of that and how they kind of skirt the system a little bit. So the basic overview of the project is that the MHRN, the Manitoba Harm Reduction Network, is supporting 9 peer-run satellite distribution sites in Manitoba. Peer-run means that it's run by people with personal experience in substance use. And satellite distribution sites are an idea that I'm sure has existed in many iterations, but the idea is that folks are offering services from where they're at, and was largely based on some similar work that happened in Ontario. So we have sites in Winnipeg, Selkirk, Brandon, Powerview, Pine Falls, Swan River, and the Eastern Interlake Ashern area. This project, just like the last one, was made possible through the Substance Use and Addictions Program of Health Canada. These peer-run satellite sites primarily operate out of the residences or places folks are staying that the operators are already staying at or living at. So these places already served as resources to the substance use community in their area. Folks are able to access supplies, overdose information training, naloxone, and peer support. In the first month of operations, we had over 500 unique individuals access services at the satellite sites in over 1,600 interactions. The satellite site operators also distributed over 36,000 syringes, shared overdose information in 500 interactions, and distributed 430 naloxone kits, and also retrieved 4,000 used needles. So the uptake of the service, that was just the first month, was super fast because operators were already known as resources in their communities. We know that people with experience in using drugs and experts in drug use do this kind of peer support work already. And so this project allowed us to offer some additional supports to the operators who are doing this work. I'll pass it over to Heather now to talk about some of the supports that are provided to satellite site providers. Unmute Heather.
Hi. So my name is Heather Crochane. My pronouns are she and her, and I'm out of Pine Falls and Arvin and Saugeen. Saugeen is, we are Treaty 1 territory. So the supports that we've been offering to our 2 satellite sites, we have one located on the south side of Saugeen and one right in Powerview. Powerview and Pine Falls are the same town. Long story short, their municipalities amalgamated a few years back. Anyways, some of the services that we offer through there are the harm reduction supplies, so safer injection kits, safer sex kits, meth pipes, and crack stem kits. The other things that we do hand out with our satellite sites is our dental hygiene kits. Like these are full size toothpaste, toothbrush, floss, and that particular gum with that one ingredient. And then in those packages, our NP brought out a free fluoride varnish that's accessible at our clinic. The other things are like socks, we're soon gonna have things like underwear, so personal hygiene, resources. I like to leave my posters for events that are coming up. But also one of the great things that I find since we started this and actually really logging, and I've been here for 3 years now, is that we're starting to see more folks come out that weren't previously because of that fear of stigma. So I want to think we're moving in the right direction with these places. And I have 2 wonderful peers that Chase is on the line. Do you want me to pass it off to Chase?
Sure. I guess I'm gonna ask I think we have Don and Chase both here right now, who are 2 of the 9 satellite site operators. And I'm hoping you guys can share a little bit about the successes and challenges of running a satellite site. So who would like to go first? Don looks ready.
And we also put food. I had a list.
Don, why don't you go ahead and share some successes and challenges of running your site?
Hi, I'm Dawn Levand, and I've been a part of harm reduction for, I don't know, 15, almost 20 years or something like that. When, I don't know, 3 years ago, I started what I jokingly called my trap line. And it was just a series of places that I would, as a person who uses drugs, went to go use drugs. And as I was going there, I recognized that the people there needed access to resources like harm reduction supplies. And then because of my experience as a community support worker, other resources like hygiene, COVID prevention materials, and food, whatever the heck it was that was free, that was available. I went and found it. I made sometimes me by myself at night, most often me by myself at night, with like 50 pounds of like supplies and stuff on my back. And I just went down my trap line from Redwood and Powers to about Corydon and Pembina. And then, you know, as time passes, then the land outscape changes. And so, you know, some people got evicted, some people moved, some people got sick, some people got, you know, and just like whatever that line was, it just kind of like was gone. But some of the successes is that the first year we ran the project, it took me about 6 months to get people like less suspicious about like me being there with free supplies for free to give away for free. And also encouraging them that if they hold my supplies for me, you know, they also could give them away for free. But after after about 6 months, I had 6 houses established throughout what we call the hood, which is West Broadway, Central, West End, and North Side, or North End of Winnipeg. That is, I guess, our largest kind of marginalized populations area of the city. And so I had 6 houses that were established in all 4 of those neighborhoods. So whatever, about 2 per neighborhood kind of deal. And that meant if I was stuck on like in, West Side, Notre Dame and Burnell, I could, go over to my friend's place over on Home Street and like not have to walk all the way to Broadway and Main, and they would hold supplies for me. And then they also continued to distribute supplies within their community. What happened after COVID was that a lot of communities that were kind of like open-ended, well, they became closed circuits. So you weren't going to get into that person's house without knowing the people that were already there. So before moving through people used to be a lot more fluid, and now it's a bit more rigid, But that was because people were just trying to be safe, which is, people who use drugs care about themselves and their communities that they come from. And so 6 houses were established to hold my supplies and distribute them. By the end of the funding, I was able to pay 2 people who were supportive to me at that time. I was holding my supplies. I was giving just whatever it was that I needed, make sure that I had support for it. And I was able to pay them $50 a week for the month, and then give them 10 bus tickets a week. And then I was able to pay one of the houses that did it for me too. So people are already out there doing the work. That's the reality. My challenge for myself is to find those people who are already doing the work, and then find a way to bring them in because they're already doing the work, and then recognize them for the work that they're doing. Because if those people out there weren't doing the work they're doing, then people like me, wouldn't have been inspired or motivated or felt, the drive to want to do the same. Some of the challenges around it is that, well, I'm transient. I mean, I had to go from being homeless to less homeless, which is not an easy thing to do, for sure. What makes it a success for that, though, is that my community of people who use drugs often are transient. And so when I'm kind of on the same level that they are, it makes it easier for me to be accessible to them. And also, we kind of do move in circuits. So I might be a part of the West Broadway circuit for a little bit, and then things go sideways, as sometimes things do with people who use drugs. And then I might be a part of the West End kind of circuit for a bit. And then, sometimes the West End circuit kind of turns into a, West End, North Side kind of central thing. And then, so it's just kind of a fluid state of living and moving and being transient.
Thanks, Dawn. I just want to make sure Chase gets a chance to talk too. Chase, would you be up for sharing some successes and challenges of operating your satellite site?
1 minute.
Sure. I'll give you a quick rundown. I have my successes were knowing who has mental issues or any kind of physical issues. It's brought to me more easily now. Having Heather has been a great help. I've been working with her for 2.5, almost 3 years, and I've had some fun, and it's been interesting time. But it's been great experience for me. I'm a ex-addict myself. I had a crack issue back in the day, and when I came here, I was coming here for my grandkids and stuff, and then I realized there's a problem, and so I opened my doors when it come to COVID, and I had myself some really fun times. And then I went to school. This got myself wanting to do some education, and now I can help these people a lot better. Being a satellite site and having the supplies is great, and I find that I go through the supplies like crazy, and a lot of people trust me, and it's been a good experience, pretty much all in all. And knowing recently we've been talking about HIV and STDI stuff. That stuff has all been put on the back burner because of the COVID, and I find that it's be a good thing to start talking about again, you know, and because COVID's going to be here, we're stuck with it. That's what I think. And so, yeah, continue on. But like these satellite sites are awesome. Like I was doing it before, and I learned that a lot of people need help. And when they know they have a spot to go, it helps them because then they feel a little more secure. And as the transient life is not a very secure life because I've been there myself. Yeah, these are great ideas, and I'm glad that we're all working together. The networking here is awesome, and that's about all.